The first step that I want to highlight is the legislation that we're going to be bringing in to provide greater protection for businesses that bring in vaccine mandates for their workforces, as well as those that implement the restriction exemption program. We've heard loud and clear from businesses. Some operations, they've got sophisticated internal legal counsel. They can hire legal advisors to give them advice on this. And we've seen major companies do this. You've got airline industries, we've got the government of Alberta, you've got law firms, accounting firms. But for many small businesses out there, there's uncertainty to them, and they have many questions. And we've heard loud and clear from them that they want certainty going forward. That is why we're moving on this legislation to provide absolute certainty that they can put in place a vaccine mandate for their workers, as well as implement the REP program without worry about frivolous lawsuits coming their way. So that's number one. Number two that we heard from small businesses that are putting in place the restriction exemption program is that there's costs associated with it. It's going to be QR code scanners, other steps that they have to do for training with their workforce as well. So that's why we're going to be putting in place a $2,000 per company program. It's going to take us in the neighborhood of 4 to 6 weeks to get this off the ground. Similar to other programs that we've put in place, we have to get the back end databases and portals all put into place. So this is going to be, the details of that are going to come in the coming weeks. But anticipate that it'll be live in about 4 to 6 weeks for businesses to get the $2,000 support that they need and deserve to get through this implementation of the REP program. And this one here, I just want to, again, appeal to the common sense of Albertans. And the reason why we're increasing fines from $2,000 to $4,000 for people that are abusive of frontline workers is that we've heard instances of individuals that are not in favor of vaccinations, that aren't in favor of providing that ID, going in and harassing workers on the front line in some small businesses across Alberta. That's completely unacceptable. And we want to send a strong signal that that type of behavior will not be tolerated in Alberta. We can accept it. It's not a part of our culture. We condemn it. So that's one of the reasons why that we're increasing that fine from $2,000 to $4,000. As the Premier mentioned as well, we want to make sure that we provide those workers with as much training as possible to deal with a de-escalation of a situation, making sure that they can keep themselves safe and also make sure that the environment is safe for those around them that are customers of those businesses. So we're going to be providing $1 million of training for business organizations to help that, similar to liquor serving protocols that we have in place to make sure we have safe work environments.
Over the last 24 hours, we have identified 1,254 new cases of COVID-19 and completed about 15,600 tests. Our positivity rate was about 8.1%. It is encouraging to see 4 days of positivity under 10%, but it is much too early to declare victory. This weekend poses a significant risk, as you have already heard. In order to keep numbers going down, we need all Albertans to have a safe Thanksgiving by having gatherings as small as possible. There are currently active alerts or outbreaks in 751 schools. Of these, only 52 schools are on outbreak. Our healthcare system remains under extreme pressure. Consider that a year ago, we had 92 people total hospitalized with COVID-19. Today, we have almost 1,100. This time a year ago, there were 24 patients admitted to the ICU. Now there are 248. Sadly, over the last 24 hours, 13 new deaths were reported to Alberta Health. These individuals were between the ages of 55 and 91. I extend my condolences to the family and friends of these Albertans. Navigating the grief of losing a loved one is never easy, but it is even harder around the holidays. Sadly, for many families, this will be the first Thanksgiving without that person they loved. My thoughts are with every Albertan who is struggling with loss this weekend. You are not alone. Please reach out if you need support or help. The vast majority of deaths we report each day are in people who were not fully vaccinated. I want to reiterate the importance of the protection of both doses of vaccine. In addition, I want to remind you that if you are 75 or older, or a First Nation, Inuit, or Métis individual 65 or older, please book your booster dose as soon as 6 months have passed since your second shot. I know there are questions about booster doses for healthcare workers. We continue to monitor all emerging evidence and follow recommendations from the Alberta Advisory Committee on Immunization and look forward to receiving National Advisory Committee on Immunization recommendations. At this time, the evidence is that 2 doses of vaccine provides good protection against severe outcomes for all those younger than 75 years old. Our provincial committee has recommended boosters for only this older group at this time. No decisions have been made on expanding boosters to healthcare workers right now, but we continue looking closely at all the emerging evidence, and we will revisit the conversation with our advisory committee later this month. I want to take a moment now to address 2 common misconceptions I have seen about COVID-19 treatments and vaccines. The first is about the drug ivermectin. Despite what you may hear on social media, the evidence from extensive, high-quality scientific research around the world has not shown that ivermectin works for COVID-19. This drug is approved for human use to treat conditions such as infections caused by parasitic worms. But COVID-19 is not a parasite, and taking these sorts of medications on your own is incredibly dangerous. We have seen people needing hospital care for serious adverse effects after taking ivermectin. Others have gotten sick from COVID-19 because they chose a drug that will not help protect them instead of the protection that vaccines can offer. The best and safest way to protect our health is by getting vaccinated. This is based on evidence from science around the world. The second misconception I want to address is around the vaccine's safety for those who are pregnant. We have seen a continued rise in the number of pregnant Albertans admitted to ICU over the last month. In fact, since my update on September 9th, when I discussed the increased risk of serious outcomes from COVID-19 for those who are pregnant, 8 additional pregnant women have been admitted to intensive care due to the virus. Between July 15th and September 28th, a total of 14 pregnant women were admitted to ICU due to COVID-19. While this may not seem like a big number to some, it is double the number of pregnant ICU admissions we saw in the entire first year of the pandemic. We need everyone who is pregnant, trying to become pregnant, or who has recently delivered to receive the protection of both doses of COVID-19 vaccine as soon as possible. This is the best way to protect you and your baby from COVID-19 and the complications that can come with it. Unfortunately, there is a lot of misinformation out there, but the data shows that vaccines are safe and effective. For accurate and reliable information, speak to your healthcare provider or call 811.